You're watching News at Prime. Let's pick up on this conversation now. The health department says that there are nearly 3,500 unclaimed bodies at state mortuaries in the country. Officials say the majority of people died from unnatural causes. The Health Department, Hospitals and Tertiary Services Chief Director is Dr. Relebohile Ncha, who joins us now. Dr. Ncha, good evening to you and thank you for your time. So many unclaimed bodies, just over 3,500. Why is this a problem that sits with the health department right now? What could be done to basically change this situation?
Good evening, Oli, and good evening to your viewers. Thank you so much for the opportunity. Yes, so indeed we are sitting with almost 3,500 bodies within our forensic pathology mortuaries throughout the country, and this is for about 125 mortuaries in total. Our biggest challenge is that the bodies that come through our forensic pathology mortuaries, most of them were unable to identify them because the deceased come through without any form of identification on them. So that would be our first point of identification. If we find something that identifies the deceased, then we're able to start with the processes of contacting family members, etc. So if we get those who come through without any form of identification, that is where then our challenge starts. Then families also don't really go out to go look for their family members, whether they go to police stations to report people missing or even take a chance of going to these mortuaries to look for their loved ones. They're unable to, or they don't do that. Hence, we find ourselves with such a high number in our mortuaries.
Am I correct to assume, at least having read a report, that KZN stands out as the province which sits with most of this particular caseload, if I could call it that, and why is that?
Indeed. So from the data that you collected from our provinces, this was now as late as March 25th. Indeed, KZN was the highest in terms of the number of bodies that are in our mortuaries. We are not clear as yet in terms of whether their challenges are unique to any other mortuaries that experience the very same problem. But indeed, there are about 1,300 of our bodies lying in KZN mortuaries.
Yeah. How then would the department propose dealing or trying to manage this situation? Because I guess for it to be sorted out, it needs for families to be contacted as to whether or not they are aware that their loved ones may no longer be alive, and therefore they then start their own process of burying that loved one. If, though, the families do not come to the mortuaries to claim the bodies, how much time is government able to give these families before it takes a decision to bury these people as paupers? Because I think that would be the description given to a body that is unclaimed.
No, true. So let me just quickly take you through what actually happens when a body reaches our mortuaries. So we go through a process of taking a photograph or a picture of the deceased and also collecting fingerprints of the deceased. Then we do get in contact with South African Police Services and we work together with them to try and identify the deceased at that point, whether, it's mostly through fingerprints. And if we do get to have some form of identification on them, we also do contact the SAPS to try and reach out to the families to inform them that their loved ones are currently in our mortuaries. So that's the first point of really trying to trace the families. When it comes to hospitals, though, it's a bit different, because for hospitals, patients would normally have a file, and in that file, there would be some sort of contact detail available in that particular file. And we also then contact our SAPS to assist us with identifying families and getting in contact with them. According to our regulations, the body that has stayed more than 30 days within our facilities, that body can then be taken through for a proper burial. That day or that time limit does get exceeded here and there, especially if we're embarking on a process of trying to identify using whatever other means that we can to try and identify the body. So we do at times exceed the 30 days, but according to our regulations, 30 days is the ultimate time that is given. So post the 30 days would then bury those bodies through a proper burial process.
Yeah, sounds like a very involved process, but it is, government does have information at its disposal to be able to try and connect a dead body to possible family members. And then, of course, you know, some people may decide that we actually are not going to respond. What would your message be to those families that may be aware that their loved one is no longer alive and they need to be claimed for them to give them a proper send-off? But they simply are not either able to do that or are unwilling to do that?
No, thanks for that question. And we do find that, you know, in certain circumstances, families would indicate that they don't have the funds to bury. But what is good to know is that if they were to contact their counselors around the area where they live, there is provision that is available from the counselor side to actually assist families with some sort of burial of their loved ones. And also, you know, I mean, we have society, we have communities, and we are calling on everybody to really come in and assist each other in this particular process. It is not ideal that a loved one who has a family that has been recognized then you know gets to be buried as a pauper. It is really not a good thing to happen. So we do encourage communities and families to step forward, first of all, if they know that their loved ones are within our mortuaries, so that then we can guide them on the next steps to follow in order to get assistance for them to be able to bury their loved ones.
Final question, and I'm just curious to know, have you come across these cases where families are made aware that their loved one is deceased, however, they simply just are not, they don't want to claim the body?
Yeah, I mean, in my previous life as a CEO of a hospital, we did come across such cases. And what we would normally do is we'd sit down with families and counsel them and actually give them this option that I've referred to now in our interview. So there are those cases, although they are rare, but they are there. And as they present themselves, then we're able to give them those options.
All right. Thank you very much for that information, Dr. Relebohile Ncha. She is the Health Department's Hospitals and Tertiary Services Chief Director. A concerning situation indeed. And if you are an affected family, I would want to think that you want to contact the Health Department as soon as is possible.